Losing weight can be hard. There are the physical and mental challenges, the lifestyle roadblocks, the dietary needs, the lack of time to do the things that you need to do to actually shed the weight. It can be a lot. For decades, dieting was the standard for weight loss. Then came surgical procedures. And now there are medical weight loss options that you can do from the comfort of your home.
Part of losing weight when you have been overweight for a while is convincing the brain that it's time to have a new set point. And I don't think, for the most part, that diet and exercise alone can do that for everybody. And we've sort of seen this in multiple situations where people cut down their calories. Maybe initially they have a weight loss, eventually they're going to plateau and possibly gain that weight back.
I'm going to get scientific for a second. The drugs we're talking about in this story impact a hormone in your body called glucagon-like peptide 1, or GLP-1. When you eat, this hormone releases insulin, and that can make you feel full. So these drugs, called semaglutide or liraglutide, better known by their brand names as Ozempic, Wegovy, Mounjaro, and Trulicity, influence this hormone and help make you feel full without the food. Here's how they work.
It will slow down the emptying of the stomach. The second thing is that semaglutide seems to interact with the parts of the brain that regulate feeling satisfied. The third thing is really an anti-inflammatory effect. Being overweight is an inflammatory state, and when you're inflamed, it's easier to gain weight and harder to lose it.
The medication is self-injected with a tiny needle once a week. A couple of important points. The drug needs to be taken indefinitely, although doctors hope that lifestyle changes may allow people to stop taking it at some point. Also, some people have reported stomach problems as a side effect. Those tend to subside in most people with time.
We generally see most successes for people who have at least 30 pounds to lose, and or a BMI of about 30 or more. Those are the people who seem to do the best.
These kind of drugs have been on the market for the past couple of years, but they were intended to help people with type 2 diabetes by lowering their A1C. But now, some doctors are prescribing the drugs to patients who are clinically obese to help them lose weight. And a pair of physicians in Chicago are using the medications to help people who need organ transplants.
I'm Annie Ganan.
And I'm Anicia Redeker. We are the co-founders and the co-directors of the Act Now Clinic. The Act Now Clinic stands for Access to Transplant Through Novel Approaches to Weight Loss. And this clinic aims to help people gain access to transplant who are currently disqualified for transplant due to their weight.
Primarily, the patients that we're focusing on right now are any patients that are pre-kidney, lung, pancreas, and heart transplant.
The duo started the Act Now program in March of 2023. Remember those BMI levels we were talking about earlier? Yeah, that plays a role here too.
There is a certain weight in which someone is not allowed to get a transplant because we believe that the transplant surgery itself might cause more harm than it would cause good for the patient. This is because there's historical data that shows that patients who have higher BMIs can have more complications in terms of wound infections from the incision from the surgery. They too can have poorer graft or organ after transplant function, and that might shorten their lifespan.
And even some patients end up spending longer times in the ICU. Yeah. So it's really all about quality of life post-transplant and hoping for better and faster outcomes.
A 2021 study found that people lost an average of 34 pounds in less than 16 weeks on semaglutide, the generic name for Ozempic and Wegovy. Now, if you're trying to lose weight for whatever reason, this may sound pretty promising. But like everything else regarding your health, it's important you talk to your doctor to see if this could be an option for you. And the big takeaway here is that this medication, no matter how helpful, is not a magic solution.